The year is 2027 and a new type of soldier has been added to the human army, the bio-AI art soldier. This elite force fights a secret war against hidden diseases, quietly protecting our health, and they've got an assignment for you. But first, some intel. Deep within your gut, there's a battle that rages unseen. It's a war between your own cells and invisible enemies that invade your body every day. Bacteria, viruses, and other pathogens sneak through your gut and try to set up camp. But you have a special defense system, a hidden army of immune cells that patrol inside your gut. These cells are part of a network called mucose-associated lymphoid tissue, or MALT. In particular, specialized structures called Peyer's patches. As bacteria try to breach your gut, these immune cells swoop in to defend you. They identify and neutralize threats, then retire to lymph nodes nearby to rest. But sometimes, these soldiers don't retire when the war is over. What happens when the very immune cells designed to protect your body suddenly turn traitor? In a hidden corner of the digestive tract, a rare cancer quietly grows called MALT lymphoma. Today, we're uncovering how this mysterious gut cancer starts, spreads, and why it often hides in plain sight until it's too late. Your gut is a long, winding tube, about as wide as your finger. Now, it's not just for digesting food, but also houses your hidden army. All along its surface are the patches, each a small network of immune cells constantly scanning for invaders. When they find one, the lymphocyte neutralizes it. If a few bad cells remain, a special T cell steps in, making sure the rest of the army doesn't miss them. Then it's back to normal. Until the next time, this process is happening across your entire body, keeping you safe from the microscopic world around you. But sometimes this intricate dance goes wrong. The war ends, but the immune cells stay in battle formation. This lingering army can start to multiply uncontrollably, forming a mass of cancerous cells in your gut. This is what happens in MALT lymphoma. Chapter 2, the spark that turns cells cancerous. Most often, it starts with chronic inflammation in your gut, especially your stomach. Picture your stomach lining, normally protected by a mucus layer that keeps it safe from the powerful acids used for digestion. But imagine tiny bacteria tunneling through this mucus, burrowing into the protective layer and setting up shop. That's what Helicobacter pylori does, a bacteria that can live in your stomach. Your immune system springs into action, sending in a battalion of cells to attack. But H. pylori is a wily opponent. It has ways to evade your immune system, causing the battle to drag on for years. This chronic inflammation is the spark that ignites the problem. Here's where things get complicated. You see, your immune cells have a lifespan. They're not immortal. But when exposed to chronic stress like fighting off H. pylori, these cells go into overdrive trying to keep up with the constant threat. This means that instead of retiring when the job is done, they keep multiplying to replace cells that are worn out or die off. But all this work comes at a cost. The DNA of these immune cells starts to accumulate scars, mutations caused by the non-stop battle with H. pylori. And when the DNA is damaged enough, it can cause the cells to lose control, becoming cancerous and losing their original function. This is when things go from bad to worse, and that's how MALT lymphoma is born. Chapter 3, symptoms that don't seem like cancer. When this cancer first starts to form, it often doesn't show any symptoms. The real trouble begins when the abnormal cells start to grow and spread. So here's where things get tricky, because the symptoms of MALT lymphoma can easily be mistaken for other less serious conditions, which is why many people confuse it with gastritis or stomach ulcers. Common symptoms include indigestion, bloating, nausea, and a feeling of fullness after eating. Some may even experience anemia due to blood loss. Imagine someone is having these symptoms, thinking it's just a flare-up of gastritis. They take some medication, feel better, and life goes on as usual. Meanwhile, the MALT lymphoma is still there, slowly growing. Now let's meet John, a 45-year-old who's been battling stomach pain for a while. He's been to see his doctor, who's diagnosed him with an ulcer. John starts taking medications to treat the ulcer, including antibiotics to kill off any bacteria that might be contributing to the problem. But despite the treatment, his stomach doesn't get any better. In fact, he starts feeling worse. He goes back to his doctor, who performs another endoscopy, the procedure used to examine the lining of his stomach. During the endoscopy, the doctor notices something strange in the lining of John's stomach. There seems to be a growth there, a bump that shouldn't be there. Concerned, the doctor takes a sample of this growth through a biopsy. Now let's fast forward a bit. John's biopsy results are back, and the news isn't good. The cells taken from his stomach lining are unjust signs of gastritis, as he and his doctor had thought. They're actually a type of lymphoma. Specifically, it's malt lymphoma, a cancer of the immune cells that normally protect the gut. John and his doctor are shocked. All this time, they'd been focused on John's ulcer, treating the symptoms and not realizing it was something else entirely. It's a difficult moment, but it's also a crucial one because early diagnosis can make a huge difference in treatment. Chapter 5, Treatment, from antibiotics to immunotherapy. That's why doctors often perform endoscopies to check for any abnormalities. It's during these procedures that they can spot any suspicious growths and take samples to check for cancer. And here's where things get even trickier. Malt lymphoma is a rare type of cancer, accounting for only about 5% of all gastrointestinal lymphomas. Because it's so uncommon, it can be difficult for doctors to diagnose right away. Many of the early symptoms are vague and can be mistaken for other, more common problems like indigestion or ulcers. This means that by the time a diagnosis is made, the cancer may have already progressed. But here's the good news. Malt lymphoma tends to respond well to treatment, especially when caught early. One of the most unique features of malt lymphoma is that it's often associated with H. pylori infection, and this gives doctors a kind of superpower when it comes to treating it. Eradicating the bacteria with antibiotics can sometimes cure early-stage malt lymphoma. However, when this approach doesn't work, doctors use a combination of radiation therapy and chemotherapy to destroy the cancerous cells. Another treatment option is rituximab, which is a type of immunotherapy that targets a specific protein found on the surface of lymphoma cells. Unlike other types of gut cancers, such as colon cancer, which tend to spread later in their development, malt lymphoma tends to stay localized for a long time, making surgical removal a viable option in many cases. Chapter 6, Survival, Recurrence, and Hope. So what does all this mean for someone who's been diagnosed with malt lymphoma? Well, the survival rate for malt lymphoma is generally good, especially when it's found early and treated promptly. 5-year survival rates can reach up to 80% for patients with early-stage disease. However, it's important to remember that not everyone's experience with cancer is the same. Several factors influence the course of the disease, including the stage of cancer at diagnosis, the patient's overall health, and how well the body responds to treatment. Let's circle back to John. After his diagnosis, John works closely with his medical team to develop a treatment plan. He starts a course of antibiotics to target the H. pylori bacteria. Since it's a big factor in his type of lymphoma, over several weeks the antibiotics work to wipe out the infection. At the same time, John undergoes regular checkups, making sure the treatment is working and monitoring for any side effects. It's a tough journey, but John's determined to fight and win this battle. After months of treatment, the results are in. John's H. pylori infection is gone and the lymphoma appears to be in remission. He's feeling better, but his fight isn't over yet. He needs to stay on guard, watching for any signs of the cancer coming back. Malt lymphoma reminds us that sometimes the war against disease starts with a spark we can't feel. But with awareness, testing, and treatment, this hidden enemy can be defeated. And now, here's your call to action. If you found this video valuable, hit like and subscribe to BioAI Art for more deep dives into hidden diseases. Share this video to help spread awareness. And if you want to support our mission further, consider becoming a member. Your support helps us continue to produce these important videos. Together, we can keep learning, keep sharing, and keep fighting for a healthier future.